Hey everyone, welcome back to the Health Data Ethics Podcast. I'm your host, Jenny Owens, and today we are diving into the newest AI tools aimed directly at patients. Let's say you're an Epic MyChart patient. You've got a new diagnosis, you're confused, and now you have new tools at your fingertips. My question is, should you use them? What do you need to know before you use them? What happens to your data if you do? In the past couple of weeks, two high-profile healthcare AI products were announced. One of them was ChatGPT Health from OpenAI. One of them is Claude for healthcare from Anthropic. Both of these models are now in the process of being integrated into electronic health record patient portals, such as Epic's MyChart, which means that if you're a patient in a system that has a patient portal like this, using these tools with your own data might be only a few clicks away. This is super exciting, super interesting, and worthy of lots of discussion. So we're going to break down what these tools do, how they differ for individuals versus enterprises, and why privacy protections might not be what you think they are. So first I want to talk about OpenAI's ChatGPT Health. This is a fine-tuned version of GPT-4. It's been trained with clinical data and it's now available as kind of a virtual assistant that can be connected to your data through your patient portal. And it promises to simplify the medical jargon, maybe draft some messages for you back to your doctor, and provide health education and kind of sit alongside you as you navigate your care. Claude Health by Anthropic is a expansion of their previous Claude for Life Sciences product. And really this is intended to support the same kind of features. So direct integration with patient portals in pilot programs. I am currently, full disclosure, I'm currently on the wait list for both of these products. And so I have not yet had a chance to connect my own data and play around with them and see how these features actually work. So today we're going to be talking about these from kind of a hypothetical and a patient rights and patient privacy perspective. Both of these companies want to stress that these models are not replacing doctors. They're intended to support patient understanding. And from a patient perspective, they're super helpful. These models can look at your test results and reword them in layperson's language. They can help you formulate questions for your doctor. So if I'm looking at my test results and I'm thinking, boy, these things all look like they're within reasonable ranges, but I'm still not feeling good. I'm scared about what the future might be. You can workshop that question with one of these tools and then be able to send a more coherent question over to your doctor. Or it can also help you summarize long notes in your chart. If you've recently had an inpatient stay, you know, those discharge notes and those summaries can get super long. This can help sort of take some of the fluff out and give you, as the patient, the most actionable and most relevant points. That's really cool, right? I want to pause here because when these tools are announced, there's a really interesting blurring happening between your use of a tool like this as a patient and my use in my day job of a tool like this as part of an enterprise. These are two very different privacy expectations, two very different legal relationships, and I want to make sure that we're really taking the time to understand what protections your data might have as a patient in both of these scenarios. So let's back up a second. I want to talk about what it means if my health system, we can talk about Jenny's totally fictional health system again. We've signed a contract with OpenAI and we now have an enterprise use of OpenAI for healthcare. Awesome. The important part of that statement is that we've signed an agreement. These are called business associate agreements. And what it does is it extends the protections of HIPAA to that business associate. It basically says, okay, if you're going to do business with me, a hospital, you're going to treat this patient data with the same level of privacy, the same expectations as I, the hospital, would. So if my hospital, Jenny's totally fictional health system, signs that business associate agreement with OpenAI or Anthropic, that means that this model can be connected not only to MyChart for patients, but also we're going to put that to the side. We can embed this model within our own clinical workflows. We can pull patient data in, and now our clinicians, our doctors, our nurses can use this tool to help communicate with the patients on the fly. So I might be able to use this to do a quick summary of a patient if I'm coming up to speed very quickly, if I'm new to service on the floor, or if I've just received a patient handoff. So all of that information, all of that use by the organization as an enterprise would be protected under HIPAA. That means there would be audit trails, there'd be access logs, there'd be defined rules around what the data can be used for. How is it stored? How is it encrypted? That's what the intention is of those protections under HIPAA. Even so, we've still seen that some large language model vendors will log prompts. So as a health system, you need to be really thoughtful about both the terms of your original contract, And how are you monitoring and auditing on an ongoing basis to make sure that you're comfortable with the privacy expectations of your use of this large language model as an enterprise? Okay, so we're setting the enterprise use to the side. Now we want to talk about individual use. I am now a patient. I'm opening ChatGPT Health in the consumer app, or I'm opening, Claude for health, and I'm clicking through. I'm finding my records. I've got records at this hospital. I've got records at this hospital. I've got records at Jenny's totally fictional health system. I'm going to connect to that patient portal via a FHIR API, and I'm going to pull in my patient data. That's all my data. Under HIPAA, I own that data. It's my right to move that data, to access it, to have uses and disclosures reported to me. This is entirely within my rights as a patient. So I can connect this, I can pull this data in, and now all of my data is flowing automatically into this tool. So today, I can open ChatGPT on one screen and my medical record on the other. I can copy and paste data back and forth. I might say, hey, tell me about what these test results mean. Summarize this note for me. But if you use one of these tools, that will all happen automatically. The important thing is, if I, the patient, choose to disclose my data to OpenAI or to Anthropic in this way, that data is no longer covered by HIPAA. I have disclosed it as the patient. The parent companies have not signed a business associate agreement with me or with my hospital system. And so that data is now outside the protections of HIPAA and inside OpenAI's or Anthropic's privacy policies, which are subject to change, right? What's the most frequent lie told in the modern age? I have read and agreed to the terms and conditions. I want to note, both companies say today that they're not going to train on your data, but there is no legal barrier stopping them from changing that in the future. We'll talk about that a little bit later. And without that business associate agreement, there's no structured oversight. There's no required breach reporting. There's no protection if that data gets reused or sold later. You're essentially entering into the same relationship with Anthropic or OpenAI as you might have entered into with, say, 23andMe, if you bought one of those consumer DNA kits. When those were, the hot thing. 23andMe has recently undergone a bankruptcy restructuring, and there's a big question about who is going to protect that very sensitive genomic data. What is going to happen to that information? People purchased these kits and signed a privacy policy under one expectation, and now the underlying business structure has changed, and so their privacy implications have changed. So same rules apply here, right? Like we are playing by business privacy policy terms. In the US, HIPAA only applies to covered entities. That's providers, payers, and their vendors under the contract. When you, the patient, choose to voluntarily share your data, that means you're stepping outside that protection bubble. That is your right as a patient. I want to be so clear about this. I'm really in favor of patients owning their data and having agency over their data. These tools are giving you more access to your own data that's not in a hospital-specific portal. And it's a fantastic thing from a patient rights perspective. You just need to be thoughtful about the trade-off. You are sacrificing some future privacy for the ability to access and work with your data today. That's your own decision to make as a patient. It's your right as an American. OpenAI says that it's committed to not training on personal health data. Anthropic says that they're building with constitutional AI principles in mind. I'm going to take this with a boulder of salt. I feel like this is temporary. I feel like we have seen this path before, right? We start to aggregate the data. People get excited. They want to develop. They want to do things with it. Those APIs might get opened up to third-party developers. We've got enterprise partners that might want custom plugins, and patients, the customers are going to demand richer data access and more tools to use on this data. I do expect that within the fairly near future, we'll start to see some developer tools that are going to let startups or others access some of this patient data. Of course, I would expect that as a patient, you'll be allowed to opt into these things, right? If I want access to, like Garmin's exciting new app, tag my wearable data along with my healthcare data for better insights into my own athletic performance. Fantastic. I want to check that box that says I agree to this. I also think we'll probably start to see some interesting ways that people will try to monetize this data. So even if the data is never used directly for training, these companies may enable others to build models that access that data, which of course brings me to my main question about all of this. If these models are trained on the subset of patients who use a patient health portal, the subset of those who are digitally literate, and the subset of those who are willing to paste data or to connect their data into a large language model, then the data that ends up aggregated in this pool of very valuable patient healthcare data, it's going to reflect a very thin slice of the real patient population. They may be wealthier, they may be better insured, they may be less medically complex, they may be very tech savvy and accepting of an exchange of future privacy for better access to data now. So we run the risk of creating tools and predictive analytics and all sorts of things that are optimized for digitally privileged patients while ignoring the needs of patients with greater barriers to care. So what are all the takeaways here? Healthcare systems need to be aggressive about making sure that they have business associate agreements for enterprise use. If your providers are using AI, and let's be honest, they are, even if you don't know about it, then for gosh sakes, let us keep that data as protected as it should be. Patients need very clear education on what protections apply when they're electing to move their data outside of that HIPAA bubble. A couple of questions for you. So if your health system uses large language models, either as an enterprise, like within your firewall, maybe embedded within your EHR, or as an auxiliary tool for people to use, who's responsible for auditing that data flow? What gets connected? What isn't connected? What are people moving back and forth physically? And how are you making sure that your risk appetite matches the risk of using the tools? I'm curious. And then if you're a patient who's really excited about using these, how are you measuring and how are you weighing that potential future privacy loss with access to the data today? I want to keep this conversation going. Please drop me a comment below on LinkedIn. You can also follow the show on YouTube at the Health Data Ethics Podcast. Thanks. See you again next week.